A very good evening to you all. Here's what we have in store for you this evening.
On the recommendation of the National Coronavirus Command Council, Cabinet has decided that the country should move to adjusted alert level 4. Cabinet decided that to ensure that our response is appropriate and proportionate, in other words, equal to the current situation, additional restrictions are necessary. And we are therefore announcing this evening that we will place these additional restrictions in place for the next 14 days.
With only 3 days left before the duration of the current lockdown expires and the situation looking worse than it was when President Ramaphosa moved the country to adjusted level 4, we're in conversation with the former co-chairperson of the Ministerial Advisory Committee on COVID-19, Professor Salim Abdul Karim.
It will be noted that in terms of Section 73(6)(a) of the Correctional Services Act, an offender serving a determined or cumulative sentence of not more than 24 months may not be placed on parole or day parole until such an offender has served either the stipulated non-parole period, if a non-parole period was stipulated, a quarter of the sentence. In this case, there is no stipulation for the non-parole period. This effectively means that the former president will be eligible for parole once a quarter of his sentence has been served. We want to assure all South Africans that former President Zuma will be afforded dignity throughout his term of incarceration.
With those pronouncements by the Justice and Correctional Services Minister, hopes have been raised that Jacob Zuma may well be out after serving a quarter of his sentence. That's if the two applications currently before the courts fail. We speak to an expert about South Africa's parole system and whether Jacob Zuma can pre-qualify, so to speak, as some have suggested. And with continuing questions being raised about the police, we speak to the head of the Police Secretariat, the body mandated by law to exercise civilian oversight over the SABC. That and more coming up. The Watchdog starts now. Let's speak to our guest now, Professor Salim Abdul Karim, no stranger to this issue, one of the authorities in the country. Professor Karim, very good evening to you, and thank you so much for agreeing to come through this evening. Now, we don't know when the next National Coronavirus Command Council meeting is going to be held. What we do know, though, is that the situation is worse today than it was 11 days ago when President Cyril Ramaphosa took the country to level 4.
Good evening, Vuyo, and it's a great pleasure to be with you here this evening, and a very good evening to all your viewers. When we look at the coronavirus epidemic, we look at the trajectory that is expected. And we know that when the president announced the move to level 4, the epidemic in Gauteng was already at a point that was getting close to its peak. And so it would be very difficult to alter that. Remember also that when we institute measures today, we only see the effects 10 days later. So today is day 10. So today's numbers it's not quite 10, but let's just say it's between 7 and 10 days. So we should really be seeing some of that impact, but it will really become most evident in today's numbers, and I haven't seen them yet. So what are we looking for? We're not expecting much change in Gauteng because of the advanced nature of that epidemic. We're looking to see how is the epidemic changing? How is the trajectory changing in the Western Cape, Eastern Cape, KwaZulu-Natal? Those three provinces are the ones where we want to slow down the rates of infections so that the hospitals can cope. And right now, we are not seeing the kinds of changes that we would like to see. The epidemic is still growing at quite a reasonable rate, although it seems to be slowing a bit in the Eastern Cape and KwaZulu-Natal, but not so in the Western Cape. So let's look at the numbers today and tomorrow to get a better idea about where we stand.
Now, I mean, I was looking at the numbers now overall. We've recorded 22,910 new infections, 460 deaths in 24 hours. It's not giving a great deal of hope.
No, unfortunately not. So we are, as of yesterday, based on yesterday's numbers, the 7-day moving average was just below 20,000. If there were 22,000 cases today, then we are looking at a 7-day moving average that has now broken 20,000. So we are now at a rate that's much higher than even at the peak of the second wave. What we are seeing is not a good sign, not a good sign at all.
What is it telling us, though? Yes, you did say that when, before the declaration of adjusted level 4, this was what we're in now was anticipated. But was it to the extent that it is currently, given what you've just said, that we've now broken that 20,000 target or average?
So based on 22,000 cases today, that means that we haven't had the kind of impact that was being hoped for in the three key provinces. I need to look at the provincial numbers, of course, but just tentatively, based on what you've said, we are not seeing that. So that means, one, that the epidemic's already too well established. Two, that the restrictions themselves are not having their desired effect, and principally that people are not changing their behaviors as a result of the restrictions. Because remember, the virus needs us to move it around and to not use the prevention measures adequately. In fact, I saw quite a disturbing set of pictures in yesterday's newspaper about Durban. People walking around the city center without masks is not a good sign. And then, everything else we're seeing with gatherings occurring for political reasons, deeply concerning, that we can't expect the virus to slow down if we're helping it to spread. So it's going to need us to respond to restrictions and to take prevention measures more seriously.
And I want to take us to a quote from the president on the day he moved the country to adjusted level 4. And I quote, "What we are seeing is that the existing containment measures in place are not enough to cope with the speed and the scale of the infections we're experiencing under what was then the third wave." So, and based now on what you've just said, the observations, and it's not just Durban, I can tell you that much. You're seeing a lot of that here in Johannesburg as well. So it basically means that even though there's been this imposition of all these regulations and us going from level 3 to level 4, none of that seems to have worked or seems to be working. Would that be a correct statement to make?
No, I wouldn't say it as categorically. And the reason for that is that if you look at the trajectory, in other words, if you look at the rate of increase in the Eastern Cape, it has slowed quite substantially in the last 2-3 days. And the same with KwaZulu-Natal, it has come down. Not a lot, but it has come down. You would expect once you hit about 10 cases per 100,000 that you're on a sharp upward trajectory. And so that's not being observed in those two provinces yet. So it may be having some effect, but the numbers are still going up. Now, what we talk about is we're just trying to slow the rate of infection, which is a big challenge with the Delta virus, because the Delta virus spreads so fast that it puts huge pressure with a lot of people needing hospital care. So this slowing down is the goal of the restrictions. The challenge is that we would like to see it have a bigger effect. The effect is too little at this point.
And that was going to be my next question, Prof, whether perhaps the big factor here may not just be, or may not be, the fact that, or an assumption that people are simply not observing. But the fact that we are dealing here with a variant that is spreading faster, and that's a lot deadlier than the variants we've encountered in the previous waves.
So, Vuyo, you've touched on really what is an issue that we are all grappling with. So when I have meetings with my counterparts, the chief COVID scientists of various countries, we meet on a regular basis. And the description I hear from many of these countries who are also challenging, and so dealing with a very challenging third wave, often driven by the Delta variant, they talk about this perfect storm that's occurring. And there are three components to that storm. The first is that we've got a variant like nothing we've seen before. This variant is really fast. It's estimated to be somewhere around 50 to 67% faster than the Alpha variant. And this is an estimation from Public Health England. An Alpha variant was a really fast variant. So this is something that is at super speed. The second problem is that we've reached a stage in the pandemic. It's now about a year and a half after the pandemic started, and people have become tired. People have reached a stage where they just can't. That complacency, I said, is very hard to motivate people. They've been hearing the same thing over and over and over, and so it's not having the impact it should. And then the third is that we're dealing with a challenge that the healthcare infrastructure, even that which was built for the previous waves, is not able to cope when the rapid fire transmission occurs and large numbers of patients pitch up trying to get care. And that applies in Malaysia right now. Our colleagues are telling us about that. We're working with our Indian colleagues previously with the Delta variant, the same problem. I mean, it's across the board that people talk about these three problems that we're having.
Now, taking all those three problems now together, then, Prof, we're dealing with this deadly variant that's spreading a lot faster than anyone would have thought, given the fact that everything we have put in place, or we've been able to put in place up until now, to deal with the previous waves, seemingly isn't working. What options then does that scenario leave those who will have to take decisions over the next couple of days before the 14-day period expires on Sunday? Realistically, what's still there to play around with?
So I think in terms of the overall impact, we'd be best placed to measure that on Saturday, where we would look at anticipated trajectory and observed trajectory and look at what the difference was. If that difference is creating some confidence that we're seeing some impact, especially in the three provinces, then there's a good case to continue some of these restrictions, if not all. If it's not achieving that, I'm afraid that there's not much more that's available to us. The tools and the measures that have been used in the current level 4 lockdown are really quite substantial. The next step would be a stay-at-home order. And that's something we don't really want to implement willy-nilly because of the huge impact it has on our economy. So there's not that much wiggle room that's left to us. I would say the main additional factor that we could be really thinking about is better enforcement of our rules. In other words, doing more, and I'm not sure whether putting more people in jail is going to help, but I think it's really about, getting all of us as citizens to take a role in this. When I go for my morning walk in the mornings, every person I see with a mask on the chin or not wearing a mask, I stop and I tell them about it because I think that that's my duty and responsibility. And I think all of us need to be doing that so that we're helping our fellow citizens to take up these prevention measures, because that's going to have the biggest impact, actually.
Now, South Africans, or great majority of us, Prof, have never had the opportunity to be able to sit and observe how conversations, take place, whether it's at the Presidential Coordinating Council, whether it's the NAT joints, or whether it's the National Command, Coronavirus Command Council, and whether it's Cabinet. We're not privy to that environment, and how decisions get taken after what one would assume would have been very robust discussion. Are you able to put us in the picture, to just to take us through that when a crisis like we are in now, or we are approaching, if we haven't approached it already, then, where are the pressure points? What becomes, the main conversations or talking points?
Yeah, so now that I'm no longer part of the Ministerial Advisory Committee, I'm not involved in these discussions and don't know what the debates and so on are. I can tell you about what it was like, prior to March. And when I would attend the Command Council meetings, it's essentially a meeting of the Cabinet, all the ministers are there. The Minister of Health would lead the discussion and would deal with the key issues. And he would then call on myself, he would call on the mathematical modelers, and he'd call on the Director General to do short presentations. And after my presentation, I would get nothing less than about 30 to 40 questions. So and they bombard you. So, Minister Patel will ask a question, Minister Pando would ask questions, and they're all trying to understand the implications of what I've said for their ministries. What are the implications? And they're quite probing questions. I mean, often I would say to the minister, I can't answer your question. I just don't know the answers to those questions. But it's quite robust. I have to say, from a scientific point of view, I found them to be very probing, and they wouldn't leave many stones unturned in that Q&A session. I think the last one, I write down every question that they ask, and I number them, and I note who has asked them. And I remember in my last attendance, there were 36 questions that were asked of me, and just me. Yeah.
Interesting indeed, Prof. Now, our hopes were pinned on the vaccine, which, as everyone knows, hasn't really gone the way we thought it would. Just your thoughts around why we are here, why our vaccination program hasn't gone as well as it should have or could have gone.
Yeah, I think there's a series of challenges that we faced. Some of them of our own making, some of them beyond our control. And I think the first was that the key issue was whether we wanted to join some of the richer countries and engage in vaccine nationalism by securing vaccines that were outside the COVAX attempt to create global equity. And so the decision at that time was to do both, was to go into COVAX and be part of COVAX for at least the first 10% of our population, possibly 20%, and then to engage in bilateral discussions. And some of those discussions were quite early, because at that stage, when we first started having them, we didn't even know if the vaccines worked. So it was very early stages. But what became clear was that because we were negotiating eventually to sign agreements when the vaccines had already shown to be effective. In other words, we didn't make advanced market commitments before we knew that the vaccines worked. We were not in a position to do that. We were buying the vaccines when they were already shown to work. That means that the richer countries had already secured the first amounts of the vaccine. They were prioritized, and we joined the queue too late. So we have enough vaccines right now in terms of on-paper purchases. We just don't have them coming into the country fast enough, because we were not in that first set of countries that were willing to commit very early. The second problem was that vaccines that we could be using also had a challenge in that we weren't sure whether they were effective against the variants that we had. And the evidence that was coming, certainly of vaccines we had secured from India, showed that they were not effective against clinical illness with the beta variant. And so we now had to make sure we had vaccines that we knew worked. Right? So you look at all of that, and then thirdly, our dependence on COVAX became a stumbling block, in that COVAX simply can't supply. And that's not unique to us. There are several countries in the world, over 100, that are dependent on COVAX, and they simply cannot deliver. And there's a very simple reason for that they had signed most of their agreements with the Serum Institute of India. And the Serum Institute of India is not supplying them with doses anymore, because India wants all its vaccines to be used locally because of their severe epidemic. So all of those combined to really push us in a place that we became dependent on vaccines like Johnson & Johnson and then the Pfizer. And then just when we were supposed to get Johnson & Johnson, it has a problem with the plant in Baltimore. So there were just too many things that held us up, because our vaccine rollout is simply too slow. We should, at this time, have been closer to about 10% of our population, if I'm not mistaken, by the original targets that had been set. But it wasn't a problem that we can't deliver them. We just don't have the doses. So it's one of the reasons why the Lancet Commission on COVID-19, and I am co-chair of its Africa Task Force, we put out a call asking rich countries to please donate 300 million doses. Now, there are several countries that have doses of vaccine sitting in their stockpiles that they haven't, they're not planning to use at this stage, or don't have an immediate use for, but they have those vaccines. The US is sitting with over 100 million spare doses of vaccines. Canada is sitting with millions of doses. We need them to please donate it to Africa so that we can at least try and vaccinate the elderly and the healthcare workers. And to me, that's what we should be trying to do, is trying to achieve some measure of equity in the availability of doses.
I hear you, Prof, on the issue of, perhaps money had a lot to do with it. Those who had a lot more money could buy, irrespective of whether, for example, these vaccines may or may not work further down the line. But were we not slow off the starting blocks? Is that not something we perhaps need to acknowledge? Because one, you'll correct me if I'm wrong, it looks like the information that has been out there from day one, as perhaps not the initial period, but for the longest time now, everyone basically knows what is happening in what corner of the world, what's working and what's not working. Could we not have gotten off the starting blocks a lot earlier? Were we not a bit too hesitant, perhaps because we weren't sure whether this thing is not going to work or not? And that's in part, or in large part, the reason we are here.
So I don't think that's accurate, except in one respect, that many countries who achieved high vaccine coverage very early on this year, in other words, in February, March, April of this year, they were willing to go a different route. And that route was to use vaccines from China and from Russia. If you take an example, Morocco, which has pretty high vaccine coverage in the region of around 30 to 40%, they took up the Chinese vaccines before they were even licensed, before they were even approved by the WHO, and because they were willing to take that risk. And so that's what many of the smaller countries did. The richer countries went with the mRNA vaccines, and they went to the live viral vector vaccines that were available from AstraZeneca, from the big pharmaceutical companies, Pfizer and Moderna. But the other countries were willing to go with vaccines. If you take, for example, one of the highest, most highly vaccinated populations is in United Arab Emirates. Their vaccine that they have used as standard is Sinopharm. So we chose not to take that risk. We chose to go the route of the way in which we would want all our vaccines to be used would be to first be approved by our regulator. We were not willing to bypass that step. Now, if you want to go with the regulatory approved vaccine, that's a longer process. That takes time. It takes 2-3 months to approve a vaccine because of all the stringent processes involved. So you're right. We chose not to go that route. We could have. That was a decision that had to be weighed, and it's quite a complicated political decision to say you don't want necessarily your regulator to approve a vaccine. You want to just use it. You want to take it, buy it, donate it, get it.
Okay, we've lost Professor Karim there. I don't know what exactly happened, but of course we're in conversation with him. Given the fact that we only have 3 days left before the current lockdown period expires, we were of course looking at whether, given the fact that the situation is far worse now than it was when President Cyril Ramaphosa took us to level 4, what can we still do as a people to really mitigate the impact of this pandemic? But as things stand, it doesn't look like there's much, except for all of us to make sure that there is better enforcement of the rules, the laws, and everything that has already been set in motion. The Watchdog continues in a moment. Don't go away. Welcome back. This is the Watchdog. Now, as you would have heard, as many of you would have heard or seen earlier, the Minister of Justice and Correctional Services telling us that the former President, Jacob Zuma, who spent his first night in prison, could be paroled once he serves a quarter of his sentence. Of course, that's something that got tongues wagging, people trying to understand whether he can qualify a priori, how does the whole system work. So we thought we would bring in an expert who can help us understand how the whole system actually works. Do you qualify, automatically, or are there certain things that you need to do before you can qualify? And our guest is going to do exactly that. Good evening, sir, and thank you very much for your time. If I may start, the whole idea of a parole. Why do we have something like that in our system? What does it seek to do? What's the underlying philosophy behind a parole system?
Good evening, Vuyo, and good evening to your viewers. Vuyo, to answer your question directly, the reason we have a parole system, remember that the purpose of sentencing a person, it is not necessarily to punish that person. Mm-hmm. The whole purpose is to rehabilitate that person, reform him, send him back to the society as a good human being who can contribute into our society. So that is the whole motive, reason behind parole, what we call a parole. Mm-hmm. But I would like us to refer to it as a correctional supervision, not a parole.
Mm-hmm. Now, I get to prison. I'm given a 2-year sentence. And in terms of the rule, after serving a quarter of my sentence, I qualify. So it doesn't mean that I would be given parole. It simply means I qualify. Is that correct?
Okay, let me explain it in simple terms. What happened? Let's say you get convicted, you are sentenced.
Yes.
The law, the rules require that you must serve what we call 1/3 of your sentence.
Uh-huh.
1/3 of your sentence, I'm sure those who do mathematics will, what is 1/3 of the sentence.
Yes.
Once you have served 1/3 of it, then you are eligible to be admitted in what we call a correctional supervision. Mm-hmm. However, there are a number of factors. It doesn't mean that automatically you will be admitted under correctional supervision. There are a number of factors that are taken into account. In any correctional facility, there are certain programs that the correctional facility has. For instance, there will be woodwork, let's say, participate in HIV and AIDS program, Once you participate in those programs, that build certain credits that will be in favor for you when you have to be considered for parole. Mm-hmm. And the other factors that need to be taken into account is that, in a simple term, let me just say, you must be a good boy or a good girl when we're under correctional supervision. Mm-hmm. You can participate in those programs, but if you don't show any sign that you have changed, you won't be admitted under parole or under correctional supervision. Mm-hmm. However, we do have people who beat the system, you have people who pretend as if they have been rehabilitated, they have changed after that 1/3 sentence. It is the duty or it is the job of the what we call a parole board to check if this person has indeed changed. They will do a number of things such as they will have members, for instance, who will visit your community where you will be released at or where you will be staying at after your release. They will check whether you will have any employment interview, whoever who's willing to employ you. If you are a member of the church, they will check with your pastor if he's happy with you. They will also check the victims that you offended before you were sentenced. Mm-hmm. But all these factors are not necessarily, they just get taken into account. They are not necessary, they don't give an instruction to the parole board that you should be admitted under parole. Mm-hmm. So they are not exhaustive. There are a number of factors that get taken into account.
Now, once, of course, the parole board looks at your case and, decides that you can go home, of course, you'll still be under the correctional services will still keep checks on you to make sure that you abide by your parole conditions. But it can be revoked, isn't it?
Indeed. One of the conditions that you will be given, let's say you get released today, you need to keep your nose clean, in simple terms. You must not participate in criminal activities because you are still under their supervision, under the correctional service supervision. Anytime, if you are involved in any criminal activities, they can bring you back. You are still their property. In a lack of better words, let me just say you are still in their custody. The only thing they're giving you a benefit of doubt to say, go home and finish your sentence at home. If you comply with all the requirements that they gave you, you will finish your sentence at home. However, if you get involved in any criminal activities, they are within their rights to take you back into custody. So, but let me also add, there are certain cases, certain individuals that even if they serve 1/3 of their sentences, they might not even be entitled to what you call a parole or to correctional supervision. It also depends on the seriousness of a crime that you committed. It also depends on, there are people, and you need to also understand that as far as we know, as practitioners, we do get clients who consult with us. There are people who are entitled to this correctional supervision. However, because of the backlog, they cannot get to all of them at the same time. Some they will serve half of the sentence, yet they have not yet been considered for it. Some they have served almost 75% of the sentence, they have not yet been considered for correctional supervision. So the backlog as well in our system, in our South African system, I can confirm that some, they have served 1/3, but they are still have not been considered. They have not been considered for such correctional supervision.
Very, very, very quickly on the last point you made, does it mean then it depends on who you are, or does a system work on a like first in, first out?
Vuyo, let me say, to answer that question, to be honest, there are those who are not being considered because they are not represented. They will continue not to be considered. But let's say, Vuyo, you are an important member of the society, you've got all these big lawyers. Obviously, they will knock at the doors of correctional service to say, look, our client is entitled to be released, is entitled to be considered for this parole. Why have you not done that? Correctional service will give certain reasons, perhaps, but I don't think they will tell you that this is because of a backlog. And then, as legal representative, we do take those matters to court to compel them to consider you, Vuyo, for that correctional supervision. They will oppose it, but obviously the court has to make a ruling on that issue. Since you are entitled to it and you have been a good boy in prison, you have been a good girl in prison, the court should rule in your favor. So the question as to whether do you have to be an important person or not? I will say, well, let me just say justice is money sometimes. If you've got good lawyers, yes, they will take correctional services to court to compel them to admit you under correctional supervision. That's
where we're going to leave it for this evening. Thank you very much, Given Matlombe, for talking to us this evening. So money counts, but so does your standing in society. Up next, We talk matters policing. We speak to the head of the Police Secretariat, which is an organization mandated to exercise civilian oversight over the affairs of the South African Police Service. Don't go away. Well, you would have heard people talking about the events of the past week in Ngandla and, of course, raising a number of questions about the police. And tonight, we thought we would bring in the head of the Police Secretariat, which is a body that's mandated by law to exercise civilian oversight over the South African Police Service and also to advise the Minister of Police. And with us is the head of the Police Secretariat, Mr. Alvin Rapia. Mr. Rapia, good evening. Thank you so much for agreeing to talk to us this evening. Just very briefly, in a matter of seconds, if you can, just talk us through, in your own words, what your job is, in case I misrepresented it.
Okay, my job is to do, as you have indicated, civilian oversight over the police in terms of making sure that they deliver the services to the people effectively. But over and above that, we've got the responsibility to do research. We have the responsibility to develop policies which determine the doctrine of the police. We develop legislations and we present them to Parliament on behalf of the Minister once they have to be tabled there. And we also do oversight over the police regarding the implementation of the IP recommendations.
Now, you have watched the events unfold this past week. Police drawing a great deal of criticism from some sections of the South African public about how they stood by and watched when people who posed a great deal of danger were brandishing weapons, sharp objects and guns, and seemingly doing as they please. What went through your mind when we saw the scenes that most of us saw on television, but also read some of the reports that were written in newspapers? Just your thoughts as you are watching it, reading all of it, reading about it.
What went into my mind as I was watching this, I said this distinguish the police which were regime policing under apartheid and democratic policing which we find ourselves in. And in the regime policing, it was characterized by issues of what we call skit and donor.
Stop skit and donor.
So you just shoot and you beat up people. And in a democracy, you don't do that. Democratic policing means that you need to take the people with you. People might say, oh, the police are just leaving everyone to do as they please. No, the police were doing their work at the time. And everything they do before the top unit comes in, they must be informed by intelligence. They must be, because we do what we call community policing, which is a fundamental principle in our constitution. We do community policing. It means that the police must work with community. So you weigh all those issues before you come and you say, I must deal with these people. And if you realize that you have got people also who are all out to come and just create chaos. Amongst those people who were there, I was told the crowd was maybe about 2,000 people plus minus. And those who were in the place, you could estimate maybe there were about 100 people who were armed, those who were shooting guns up there. You use cameras, you use your intelligence to monitor those people. And you de-escalate the situation because you have got an objective. The objective was the police are supposed to arrest Mr. Zuma in the instruction of the Constitutional Court. That's an objective. Mm-hmm. And that's what they should look into. And if the crowds are not are peaceful, although in a peaceful crowd you'll find sporadic incidents of those who would want to provoke the police, it will be there. But the commander of POP who is there will be monitoring the situation. If it escalates to an extent that it becomes violent, then they will come in. And I was saying to myself that the police here, they are taking even some of the recommendations from the panel of experts that was appointed by the minister after the Marikana Commission of Inquiry.
Mm-hmm. What for you, or what makes you say that? What from what we saw there says to you, indeed, the police have taken the recommendations of the inquiry and, of course, that panel, civilian panel, that was set up by the minister to heart? What from the incidents that we saw this past week demonstrated that?
There were a lot of cameras. The police had...
the minister says there were about 20, yes.
Cameras around them. That's very key because you are capturing the situation. Because as the commander in that area, you have to account. If you do nothing, you still have to go and account why you didn't. And you must have evidence why you did that. And that is at the core of professional policing, which we talk about. Mm-hmm. You have to go and account. If you go and things go wrong, say it happens that you have to intervene and there's use of rubber bullets and stun grenades, you also still have to go and account. So a professional police officer who is there will make sure that before he makes that decision to say, go in and disarm these people, you have all your facts right. Some of the recommendations from the panel of experts is that you have to de-escalate the situation, and you can sit there and observe. You can also, in the process, you will be negotiating with the organizers. You need to start with that negotiation. And make sure that this process doesn't escalate into violence. And it did not escalate into violence, which we should actually commend the police for doing their work professionally.
Now,
in the national, yes.
Now, I was going to say, I mean, you could step back, one, either because, as you say, you've learned the lessons from what happened in Marikana, and you've taken the recommendations very seriously. But you could also step back because you are frozen. You don't really know what to do. And you could have the same effect. In other words, no blood was spilled and no unnecessary confrontation actually took place. Now, how do we know for sure that that indeed is the case? How do we know that the next time a similar situation presents itself, you won't react differently because they are different or you're dealing with different players? And I'm saying this because it has happened before, whether it's taxis, whether it's in the Western Cape where crowds were dispersed in a manner that wasn't really, great, especially given that the people who were involved were elderly and simply didn't know what to do. So how do we tell?
We've got policies that they have to abide by. There is professional use of a force policy that the police have to adhere to. We also have national instructions that are there which tells them what to do. Like I'm saying, every action, because a commander in another place won't be the same as the one who was in Nkandla. He might decide to go in there. The issue of accountability is the key in terms of democratic policing. And you have to make sure all the time that you build trust between the community and the police at all times to achieve the objective, because at all time, your responsibility is to protect life and to also protect those who are in that march peacefully against those who are in the march or a demonstration who don't want peaceful demonstration. That's at the center of that. So every situation, if somebody goes and don't observe those rules and the policies, they will have to account. In some cases, they have to go into a criminal process where IPID will come and investigate how they conducted themselves.
Well, let's hope that indeed lessons have been learned, and what we saw was, as you say, Mr. Rapia, a display of the good things that are beginning to happen within the police service, having learned the lessons we learned at a huge cost in places like Marikana. Thank you so much for coming through this evening. Alvin Rapia, who is, of course, the head of the Secretariat, which a body that exercises civilian oversight over the South African Police Service, that also advises the minister on how to do things better. And that's where we're going to leave it this evening. To join us again tomorrow evening, 8 o'clock sharp. From me and the rest of the crew, it's a good night.